Welcome to our webinar, Putting Plant-Based Diets on the Menu in Healthcare. We're so happy you could join us today. I'm Sharon Palmer, a registered dietitian and nutrition consultant for the Oldways Vegetarian and Vegan program. So for those of you who aren't familiar with Oldways, I just wanted to share a few facts about the organization. We're a nonprofit nutrition education organization whose mission is to inspire people to embrace the healthy and sustainable joys of the old ways of cooking and eating. These are heritage-based diets that are high in taste, nourishment, sustainability, and joy. And since 1990, we've helped people live healthier, happier lives by offering educational programs, resources, and recipes based on shared cultural food traditions from around the world. So it's a mission we take great joy in, and it's one with proven nutrition and emotional benefits. We're going to be hearing from two amazing speakers today, Alana Braverman and Anna Hervey. We will be discussing strategies for including more healthy, sustainable plant-based options in healthcare facilities. So just to set the stage, right along with this growing interest in plant-based options among consumers, we're seeing this happening in healthcare facilities too, which really spurred the creation of the Coalition for Plant-Based Foods in Hospitals. This was really founded to provide services and programs to make it easier to provide more healthcare facilities with these plant-based offerings. And so some of the organizations included in the coalition are Oldways, PCRM, Meatless Monday, and Humane Society. And there are numerous actions in this area. For example, California and New York have mandated plant-based options in healthcare facilities through legislation. And we do have other activities such as the AMA has their program, Healthy Food Options in Hospitals. It's a resolution that, among other things, promotes more plant-based options. And Healthcare Without Harm also has another program called Healthy Food in Healthcare Pledge. That includes more plant-based options as well. So we also have the really great program, the Oldways Plant Forward Plates Healthcare Toolkit, and this is another resource that can make it easier for offering plant-based options in healthcare facilities. And it includes many resources such as recipes, over 40 recipes that are scaled up to 100 servings. There are therapeutic menu plans, HACCP instructions, nutritional analysis, and food ordering guides in this toolkit as well. So go check it out. And I just wanted to provide you with a few housekeeping notes as well. The attendees will receive an email within a week with their CPEU certificate, slides, and recording. And you can visit oldwayspt.org/CPEU to register for upcoming webinars and events. So go check it out. And you can use the Zoom platform using the chat function if you have any questions. So please make sure to join us for our future webinars and events. So with that, I'd like to introduce our two speakers today. First of all, Alana Braverman will be speaking, and she's a co-director of Greener by Default. Her work focuses on the nexus of climate change and food. She gave a TEDx talk on the topic, Moving Beyond a Hamburger Default World. So go check that out. Alana holds a master's degree in animals and public policy from the Cummings School of Veterinary Medicine at Tufts University and a bachelor's degree in natural resources and environmental sciences with a focus on human dimensions from the University of Illinois. Anna Hervey is a nutrition education program manager for the Physicians Committee for Responsible Medicine, a Washington, D.C. based nonprofit organization dedicated to promoting preventive medicine, especially better nutrition and higher standards in research. She's a registered dietitian and a certified diabetes educator with a doctorate in health sciences. Prior to joining PCRM, she worked as a clinical dietitian and a Food for Life instructor at Adventist Health Howard Memorial Hospital in Willits, California. Dr. Hervey received her Master of Science degree in nutrition from Bastyr University in Seattle and went on to earn a Doctor of Health Sciences from the University of Bridgeport. So welcome to our speakers, and we're going to start off with Alana Braverman.
Hi, everybody. My name is Alana Braverman, and I'm the co-director of Greener by Default, a program that tries to help healthcare institutions and many other types of food service management transition to a plant-based by default model for their food service. So as many of us know, without changing our diets, agriculture alone could produce enough emissions to surpass the 1.5 degrees of global warming that we need to stay under in order to meet the Paris Climate Agreement. And there's one sector in particular that has an outsized impact on climate change. Globally, animal agriculture uses 77% of all farmland and produces 57% of all of our food-associated greenhouse gas emissions, but produces only 37% of the world's protein and calories. Luckily, there's a simple and accessible solution to move away from animal agriculture. Plant-based meals have a carbon footprint on average half that of animal-based meals, which is better for our climate and our future. The good news is that a lot of people are already starting to eat more plant-based foods. The vast majority of millennials and Gen Zers are already eating plant-based foods at least 1 to 2 days per week and want to be eating even more. And most people who are buying plant-based foods actually aren't vegans or vegetarians, they're omnivores. A survey conducted in 2019 found that 40% of households who buy both plant-based and cow's milk and 98% of consumers who buy plant-based meats also buy animal meat. This is actually great news because we don't need everybody to eat a fully plant-based diet. We just need people to eat more plants, which is exactly what we've been able to do with our program and our approach with behavioral nudges. So the question becomes, that all sounds great, but how do we actually encourage this shift? How does this work? So our program was inspired by Nobel laureate Richard Thaler and Harvard professor Cass Sunstein, in which they examined the profound impacts of nudges, specifically defaults, have on human behavior. So a default is the option people end up with if they don't make an active choice. People just tend to stick with the status quo or the default option, partly because in a world today where we constantly are making decisions and have decision fatigue, it's just one less decision to make, and partly because it seems like the more acceptable option. People really don't like going against the grain. One of the most commonly discussed examples of the power of default actually comes about when we talk about organ donation. So for example, in countries like Germany, where people are by default not organ donors and they must actively opt in to become an organ donor, in Germany, they see participation rates less than 15% of people opting in and making that active choice to register as an organ donor. Whereas in Austria, a very similar socioeconomic country to Germany, people are by default organ donors and they have to physically opt out, sign a form, register to not become an organ donor. Close to 100%, over 95% of their population are in fact organ donors, which means they're saving a lot more lives. And this is just a simple policy change. This is not that the people in either country are that different. It's just normal in one country and not in another. And so that's just an example of how powerful defaults can be. So getting back to a little bit about what I said in the beginning about our program, Greener by Default works with institutions and corporations to offer plant-based meals by default with the option to opt in for meat or dairy products. It's flexible because it can be served in pretty much any environment where food is served. It could be an office meeting, a conference for thousands of people, an all-you-care-to-eat setting. We just have different strategies for those different approaches, which I'll get into. And this program is either cost neutral or it can't even save money in some cases. So I quickly just want to talk about one study that was conducted where they did a plant-based catering trial. So in this specific study that was conducted at a Harvard conference a couple of years ago, they had one group of participants that were coming to the conference get a registration form where the RSVP said, meat meal will be served by default. If you'd like to opt for a vegetarian meal, you can check the box below. And the other registration form was the opposite. It will say a vegetarian meal is going to be served. If you'd like a meal with meat, you can, check this box. What they found was that 43% more people chose the vegetarian option when it was the default option. And so again, that just shows that people got the same forms. They weren't told anything differently or described differently about the meals. But when it seems like that's just the option everyone's having, maybe that's the one that's being prepared more carefully, that the chef put more thought into, things like that. When it just seems normal, way more people are interested in trying it out, which I think goes against the myth that, people don't want to try vegetarian or vegan foods. It might just be that it always feels like it's the other option, but if you make it the norm, people want to try it. Aside from plant-based meals being more, people wanting to eat them more when they're the norm and they being more sustainable as well, they're also more inclusive. So if you're serving plant-based foods by default and still giving people the option to, opt in for a meal with animal products, it just includes everybody. It includes the 30 to 50 million Americans that are lactose intolerant and couldn't eat a meal with dairy. It includes many different religions that encourage vegetarianism or veganism or even restrict certain animal products. It includes the younger generation of people, which I already talked a little bit about earlier, who want to be eating more plant-based foods, not only for their health, but for their future. And also communities of color. I think this is a lesser known fact. There was a survey done a few years ago that found that 31% of Americans of color have reduced their meat consumption over the past year, compared to about a quarter of Americans overall. And so again, by serving plant-based foods by default, it, some of the top 8 allergens, it covers, eggs, shellfish, dairy are all not being served by default. Obviously, you're not getting everything. You still have to be conscious about gluten and nuts and things like that. But if you're still giving people the option, that they can opt into meals with animal products, it's just easier to serve food this way. So what do we do? When we're working with one of our clients, first we conduct a menu analysis where we are looking over their menus and showing them the different types of strategies that they could implement in different cases. So some examples are menu engineering. We'll say, oh, you should move this to a different place on the menu, or you should label things differently. You don't have to label it vegan potato salad when you already have a vegan symbol next to it. You could say creamy dill potato salad, with a little symbol next to it, things like that some dining directors might not have thought of before. It can actually increase the sales if you're not pointing to things specifically being plant-based, but just describing them deliciously. A big one is ratios. So if you're having a buffet line at a conference or have an all-you-care-to-eat dining facility, most oftentimes we'll see something like a taco bar where you'll have your shrimp and your chicken and your pork and your beef, and then maybe roasted vegetables, or maybe even just one like Beyond Meat or tofu option. What we're saying here is we'll work with you over time to switch that ratio. So you're actually offering a majority of plant-based proteins to animal-based proteins. And that can start off slowly. If you're currently offering 5 animal-based proteins and 1 plant-based protein, we'll say, okay, let's do 4 meat-based proteins and 2 plant-based proteins next month, and then try to do 3 and 3 and see how that goes, and continue to work with diners and look at satisfaction rates to make sure that's all going over well, and then really get you to that 2-to-1 plant to animal-based ratio, which is what we're aiming for over time. And then the last is the big one that I've already mentioned. If we can actually implement a literal default, that is best case scenario. So that's where your base is plant-based and you can add animal products to it if you would like. And then we help with the actual rollout of the culinary implementation, and then we calculate impact analysis and diner satisfaction. So who do we work with? We work with hospitals, universities, companies, and conferences right now in order to implement these changes. And I'm going to share 3 examples today of places that we are currently working with and have worked with before on implementing these changes. So the first one that I think folks on this call listening to will be most excited about is our recent work and victory with New York City Health and Hospitals. So announced in September of 2022, Mayor Eric Adams at a White House conference released the information that all of the 11 public hospitals in New York City are now doing a plant-based default lunch program for their patients. And because that's gone so successfully, they're actually rolling it out to dinner. So I'm going to say a little bit more about what that means. What that means for this context, for these hospitals specifically, is when a patient coordinator goes into the room to ask the patient what they would like for lunch every day, if they're eligible to choose, whatever meal they'd like, what they say is, would you like the chef special of the day, which might be a pad thai with tofu? That might be the first option. And then the patient can say yes or no. If they say yes, they get that plant-based meal. If they say no, they're offered a second chef special of the day, which is also plant-based. That patient can then obviously say yes or no. And if they say no to that second chef special of the day, then they're offered a variety of different options, which might be, vegetarian or animal-based. And what they found is that over 50%, actually close to 60% of the patients who are eligible for a plant-based meal are ordering one of those 2 chef specials every single day on average across all of the 11 hospitals, which is just wonderful. We can only assume that before this was implemented and both the chef specials of the day were meat-based or dairy-based, we would see very, very low numbers of patients, actually saying, hey, I don't want the specials. Could I ask for something different? Do you have anything vegan? Aside from the patients who already identify as vegan or vegetarian. And so this just shows that huge shift. And it also shows, we found that over 95% of patients were satisfied with their meals, not sending them back, only thumbs up, which is great. And so we're serving healthier, more sustainable meals now to so many more patients in the New York City hospital system. And we are looking for other places that want to do this as well. So if you work for a hospital system or healthcare facility that wants to try something like this out, we know places offer different menus and different ways that they ask patients what they want. We have different approaches for this, but we are looking to actually find another hospital to do this with next, to publish a paper on it. So if you know of anybody, please feel free to reach out. My email's at the end of the presentation. The next example that I want to give is for those of you that are familiar with sustainable products that have the B Corp label on it. Their parent company, B Lab, is hosting a conference this November where they have decided, they came to us to say, hey, we want to work with you to align our food values with our other sustainability values. We're working on zero waste and less plastic and reducing our emissions from flying, things like that. But what about food? And so we helped them draft this language for their RSVP form for their conference, which says B Lab US and Canada is committed to aligning our event hosting practices with our values around climate justice. To reduce our environmental footprint, we will be serving plant-based meals by default. If you prefer something different, please indicate below, with a section to also indicate further dietary restrictions or allergies. This is actually my form, which is why that box is already checked. But normally someone would have to check a box to continue. So this is one way to do a default approach where you're making sure that people are actually almost opting themselves into the default or choosing meals if they would like. But what they found with this approach is that 86% of the people that have signed up for this conference are sticking with the plant-based default meal, which is just wonderful because now the conference can go ahead and order, 85% plant-based meals for their receptions and plated dinners, and only have to order the meat for the people who want it, which would lead to less waste in terms of animal products, which are the most resource intensive products to begin with. And also they know a lot more about their population now. And they know that, we can probably do a mostly plant-based event and folks will be happy with it. So that's really exciting to see. And I'm looking forward to attending this conference and tasting all of the delicious food. So also, if you run a conference, know of people who, organize conferences, this is a great way to align your food sustainability values with your health values and climate values and all that. And then the last example that I'll share today is we recently worked with a large tech company at one of their offices in the US to implement 2 things. One, we re-ratioed their menus over time. So as I was talking about before, this company specifically had an all-you-care-to-eat dining facility. They had 8 entrees a day. They were normally serving 5 meat-based entrees and 3 veg entrees. We worked with them over 3 months to switch that to 3 meat-based entrees and 5 plant-based entrees. And that went over really well. We did kind of a slow rollout where we switched a couple of things the first month, a couple more things. We do 3-month pilots to make sure we're getting diner satisfaction data along the way. And then the other thing they implemented was an oat milk default, which means now when you go into their coffee shop and you order a latte, unless you specify otherwise, it will come with oat milk. So if you say I want a latte, it comes with oat milk, but you can still ask for dairy. And what they found with both of these interventions is that meat and dairy consumption, both in the cafeteria and cafe, reduced by over 50% just by switching the default option and changing the ratio of meals served. And diner satisfaction stayed the same. And some people actually said how happy they were that there were more plant-based options. So now that I've shared kind of 3 stories, just to wrap up here with our next steps, like I said earlier, we're trying to approach more hospitals to follow New York's lead and make this change, conduct more pilots with different food service approaches, looking to get a paper published on that. And long-term, we're looking to establish new norms in healthcare facilities. So like I said, if you're interested in this at all and want to chat, please reach out. Some key takeaways as well that I want to point out that I've kind of talked about briefly throughout the stories is decision autonomy is so important to our program. We believe that one of the reasons like implementing a fully vegan or vegetarian day of the week, or even a fully veg meal, you're going to get some pushback, right? From the maybe 2 or 3 people out of 100 that are really upset about it. If you just make it the default option, those people can have what they would like. You don't get the pushback, but many, many more people are eating sustainable plant-based meals. Wording choices also matter when it comes to conferences, which is why I went through that RSVP form specifically. We help with all of that. When we consult with someone, we help draft that language to make sure that it's aligning with the values of the company and making sure that it makes sense to everybody. Also, we don't change things overnight. We work over a couple of months to make sure we're rolling things out in a way that the dining staff and the labor, it makes sense for them and also for the diners. Key stakeholder involvement is also extremely important to get anything like this started. You really need to have internal advocates. So that's why anybody listening to this call, if you are involved in any of the planning processes or food ordering, your involvement is really important to help make this happen. And getting that first win is always key. So now that we've worked with a tech company and worked with a hospital system, we are leveraging that to work with other places as well. And so, we provide consultation, as I said, implementation guides, we help with sourcing and menus and educational materials, and we'll also calculate impact. So please be in touch. If you'd like any more information, you can visit us at greenerbydefault.org or contact me at ilana@greenerbydefault.org. I just want to take this time to answer a few common questions that we typically get just to finish up. One is I get asked a lot, do we promote, especially in a healthcare setting, whole food plant-based items or processed plant-based items? And what I say is we want to work with our clients in what they want to do. If they're saying we're serving, hundreds, thousands of pounds of beef, and we really need to cut that down, but people love the taste of a burger, I would say, okay, well, maybe in that case, you do want to offer a Beyond or Impossible Burger or a processed plant-based product, if that's what you're trying to achieve. Tends to be for university audiences that's the most important thing. If you're saying, we want to replace beef or chicken with whole food plant-based, that's also great. So basically our approach is we want to help you with your goals. So if you tell us our goal is to do this, we will go along with that. We don't really have any say into what type of plant-based products you're serving. That's up to you and what values are most important to your audience and what you think will go over the best. Another question I get is price issues that specifically plant-based processed products, like Neoco's cheese and Impossible Burgers, they're more expensive than like beef, cow's milk cheese, things like that. That's true. I mean, I'm not going to lie and say that those specific products are cheaper than their alternatives. I will say that from some of our university clients recently that we've been talking to, the price of Beef, for example, has gone up so much with inflation that they're actually looking to switch to some soy crumbles or things like that for chilies or burgers, just because it actually makes a lot of sense right now. So why not make that switch and have it be more sustainable as well? But you also, beans, lentils, grains, veggies are not more expensive than animal products. So that all depends again on your budget, what you're going for, but there are plenty of plant-based recipes that are actually much cheaper than animal-based recipes. And it's just about, cooking with different spices and diversifying the plant-based dishes that you might know how to work with and cook. Someone also had asked before about regional differences that I get sometimes. I live in the Midwest. I'm in Chicago, so I get it. Someone said, I work, in Wisconsin. I could never see this happening, going all the way to a plant-based default. That's okay. We work with people where they're at. Like I said, if you have a sandwich menu and 9 out of 10 sandwiches have animal products, we're going to say, let's just work with 1 or 2 to start. Let's work on developing those recipes, make them really tasty, figure out what your population is looking for in terms of, taste and texture profile, see how those do. If they do really well and you're able to see that success, it's much easier to make those further changes. So again, we're meeting people where they're at and starting there and working our way up to whatever is possible for that specific population. And then overall, in terms of the last thing I'll say, I also get asked a common question about, we promote plant-based by default. What about plant forward? I would say that, if you're at the point where the only thing you can do right now is implement a, mushroom and beef burger patty, like a 30% mushroom, 70% beef blend as like a first step to get people to try things and say, oh, that's better, that's plant forward. Or if you're able to do what they call the protein flip, where instead of a huge piece of chicken and, small amount of rice, small amount of veggies, and you're able to make a lentil and quinoa dish and then a roasted vegetable and then a small amount of chicken. That's also a great way to reduce animal product consumption. Something to say there overall that I recommend is, as much as possible on your menus, even if you're not eliminating meat, if you can get away from serving whole, like big amounts of meat, like a chicken breast, a turkey leg, things like that, and serve shredded meat maybe on top of a bowl. So you could do a bowl that normally comes with tofu, but people can opt in for chicken. But then when they get the chicken, it's like shredded chicken on top of it. That's also going to cut your meat consumption drastically. So again, there are lots of plant forward ways to do this as well if you're not at the plant-based part yet. But I hope you all found this presentation encouraging to try some of these changes out. And again, please be in touch if you have any questions. Thanks so much for your time.
Hi, everyone. So great to see you all, and so great to hear about Ilana's great work with default vegetarian meals. Very exciting what's going on in New York. So I am here to talk about a case study. Before joining the Physicians Committee, I had worked for 4 years as a clinical dietitian at Howard Memorial Hospital. This is in Willits, California. We're about 3 hours north of San Francisco in the Redwood Forest of Mendocino County. And this is a 25-bed critical access facility. And I'm just going to share some of the menu changes that happened or that we worked on while I was there at this hospital, and how we came to be in compliance with the American Medical Association's guidelines for hospital food. So just a little background here. In California, we have this bill, Senate Bill 1138, and this requires healthcare facilities to make plant-based options available to patients, and then defines plant-based as containing no animal products, byproducts, and this includes meat, poultry, fish, dairy, or eggs. And then the American Medical Association resolution, this was put out in 2017, and calling on U.S. hospitals to improve the health of patients, staff, and visitors by doing 3 things. And the first one here is providing a variety of healthy food, including plant-based meals for patients. The second one is eliminating processed meats from the menu. And third is providing and promoting healthful beverages. So for this presentation and in the context of my experience at Adventist Health, we're going to be talking about the first 2 points of this resolution. And again, resolution 1, we're going to start with that, which is providing plant-based meals for patients. So what we did at our facility is we actually had a chance to upgrade to a larger facility and kind of revamp everything, including our menu. So we switched from a set menu style to a room service menu. And this was part of our patient-centered care philosophy, where everything in the hospital we believe should be centered around the patient to make their life easier. And this means giving people choices. So with the room service menu, we can give people more choices, and we made sure that plant-based options were on this menu. So patients can now order anything from the menu any time of day within the operating hours of the kitchen. So we did a lot of recipe development in this phase. Our executive chef at the time had a background in plant-based cooking, so he did some testing and standardized a handful of recipes that were then added into Seaboard, and this is our nutrient database, and printed on the room service menu. So now they're offered regularly. We used to have little plant icons next to the plant-based options, indicating that they're the healthy choice. But we also had little salt shakers for low sodium diets and other icons. It just got too cluttered. So instead of that, we do just rely on one-on-one education with a dietitian who will review the menu options with each patient that they see. So I wanted to share a few examples of the meals that we serve. For breakfast, we have this right here is a homemade granola with fresh berries, but we also have oatmeal. We have a power porridge, which is a hot cereal made of brown rice and quinoa. We have this wonderful vegan pancake recipe, which is a really popular choice among patients. And then you could also get a tofu scramble with veggies and a side of fresh fruit. And then some lunch and dinner options. We could get tacos or burritos with tofu, vegetables, and beans. We have a black bean and quinoa patty that'll come with a side salad. And then a brown rice and vegetable stir fry. So I will note that these are not what people expect when they come to the hospital. And we do have other meals as well that are more standard that people are expecting when they're sick. But where these plant-based meals really come into play is when a patient comes to the hospital and they learn that the reason they're in the hospital could be related to what they've been eating. So our dietitians will go through a list of some plant-based foods that they should be eating more of to help their chronic condition. And then these foods are right there on the menu for them to try. As a dietitian, I know this makes a really big difference when I talk to patients about what they should be eating and they're ready to try new things. And then the foods are right there on the menu versus if they were not there on the menu, it would kind of leave the patient's mind and they wouldn't have that opportunity. So moving on to desserts, we have some plant-based desserts like chocolate cake, we have a carrot cake, and then fresh fruit. Just like the pancakes, the carrot and the chocolate cakes here are by default free of animal products. So patients will order them just because they want a dessert and they're not necessarily knowing that these are plant-based. And this is an example of how we make plant-based the default option in some cases. For example, a clear liquid tray, just like this, it would come with a vegetable broth automatically, unless the patient is specifically asking for something different, like a chicken broth. And now some patients do have increased protein needs. So we've recently transitioned to mostly plant-based supplements for protein. So if a patient has a low appetite or they need to gain weight, they can choose between maybe a house-made smoothie, which we have with fresh fruit, and then we'll add Orgain protein powder. Or we have these Kate Farms supplements in chocolate and vanilla, and we would send those a couple times a day. We also have a closed system plant-based tube feeding formula by Kate Farms. And these are all made with pea and rice proteins. And then we're actually lucky enough to have our own 5-acre organic garden. This is across the street from the hospital. It's called the Commonwealth Garden, and it's run by the Howard Foundation, which is a community nonprofit that partners closely with the hospital. So with this, we can serve seasonal produce as part of our menu. So our garden coordinator, she comes into the kitchen a few times a week, bringing the fresh produce. Maybe it's root vegetables, zucchini, lettuce, a lot of microgreens, strawberries in the summertime. And then she'll collect food scraps that they go back to the garden and get used as compost. So I want to move on to resolution number 2, and this is eliminating processed meats from the menu. The reason for this is mainly because of the cancer risk the World Health Organization has classified processed meats as a group 1 carcinogen. And this is the same class as asbestos and tobacco. So not something that we should be serving to already sick patients. But what is a processed meat? So processed meat here refers to any type of meat that's been transformed through salting, curing, fermentation, smoking, or other processes to enhance flavor or improve preservation. And here we're talking about hot dogs, ham, sausage, bacon, corned beef, beef jerky, deli meat, chicken nuggets, and Spam. So what we did at our facility is we rethought our breakfast sausage specifically. So with our room service menu, there's a lot of options to kind of crowd out the breakfast sausage on the menu, but we also wanted a one-on-one direct replacement. So our first attempt at this was in 2017, and our chef came up with a homemade sausage recipe. It turns out this was not the best strategy. So it turned out differently depending on the cook who made it. Sometimes it was good, sometimes it was bad. We had a lot of complaints. So we ended up just going back to serving that old chicken apple sausage that we had on the menu. But a year later, we looked at things with a new lens. This time we did some taste testing of sausage alternatives, specifically plant-based sausage alternatives. And it turns out that beyond sausage, hot Italian bratwurst, this was the winner among meat eaters specifically. And we also have a Morningstar sausage patty that we also have on the menu for breakfast. And I will note that these meat alternatives, they're transition foods. We're not saying they're healthy or they're the best option, but they are better than the processed meats. They're not linked with the same risks. The Beyond sausage is really high in sodium and saturated fat. So when we serve it, we make sure to serve it in half-size portions, and hopefully we can talk the patient into adding some healthier things to that meal as well. So some keys to success during this time included, we gave out lots of free samples. People love free samples. So we walked the halls, encouraging people to try the sausage alternative. And then we set up a voting station in the cafe where people could vote on their favorite option. We made sure the staff was involved and educated. We've sent out emails, we put up posters outlining the risks of processed meats. And we especially focused on the nursing staff and the CNAs because they have the most interaction with patients, and they represent the largest portion of hospital employees. And then with all this positive promotion, there wasn't a lot of pushback when it came time to actually making the change. We prepared people really well, and it always helps that we can offer that tasty alternative, whether it's just a plant-based meal that doesn't happen to include sausage, or it could be that sausage replacement. So meat alternatives like that sausage can be expensive. So our strategy was to have plenty of cheaper whole food plant-based recipes on the menu to balance things out. Now this will vary across facilities, but what we found is if you replace a 2-egg omelet with cheese, say you serve oatmeal and dates instead for one meal, you can save 96 cents per serving. And then if you have a beef burger patty on your menu, and instead you're promoting this bean and quinoa patty, you would save $1.41 per serving when the patients choose that option. And say you have a chicken stir fry and you can talk someone instead into a tofu stir fry, you could save 64 cents per serving. And we have some recognition in the Press Democrat. This is a local newspaper out of Santa Rosa. This ad was run a few years ago, encouraging other hospitals to also adopt the AMA Healthy Hospital Food Resolution. And here's an article in the Willits Weekly. This is about our Food for Life classes. So once you have healthy hospital meals on patient trays, the next step is to educate the community. And we do this through our Food for Life cooking classes. So say, for example, a patient comes into the hospital, they have diabetes. They'll get a consult with a dietitian while they're in the hospital, but they also have the option to follow up with an outpatient dietitian and then also attend any upcoming cooking classes. And our cooking classes will focus on topics like cancer prevention, diabetes, heart health, or just general health. The participants get to learn why plant-based foods make a difference. They also get to see the recipes cooked right there in front of them and then eat that food to see if they like it. In addition to that, we have our Blue Zones project, which is an all-encompassing project across the county with the goal of improving health of our employees, our patients, and just the whole community of Mendocino County. And the Blue Zones project is focused on Dan Buettner's research with the National Geographic, where he set out to find the world's longest living healthy populations. This led him to the Power 9 principles of longevity, and one of these is eating with a plant slant. So in our partnership with the Blue Zones, we're proud to be serving hospital meals with a plant slant. So I wanted to go over some challenges that we had during this time. Primarily, we struggled with understaffing. I know we're not alone in this in healthcare. It's taken a lot of patience and just knowing some days are going to be harder than others. But as we grow our staff again, every new employee in the nutrition services department goes through a short training on the risks of processed meats. So this really helps to make sure that everyone's on the same page when they're talking to patients. And we haven't had a whole lot of time for recipe development beyond our original recipes, but with our room service menu, we have some flexibility to mix and match different things to cater to patient needs. And we did have some complaints at the beginning of all this, as you expect when you take something off the menu that people are used to. But it's interesting that we've been doing this now for 4 years, and as we just continue on, we hear fewer and fewer complaints. And overall, we've had more successes than challenges. The goal with these healthy meals and community education is really to reduce patient readmissions. And with capitation in our county, this is a really good thing for the hospital. With our Food for Life classes and our Blue Zones project, we can help make a positive influence on the community and keep patients out of the hospital in the first place. And then we also have a positive impact on the health of our employees because we offer a plant-based option for lunch alongside the meat option every day. And we've noticed that people who might not otherwise take an interest tend to maybe try this plant-based option, whereas they otherwise might not do that. And then I also wanted to take this time to address some commonly asked questions. For example, our food service staff is all internal in the hospital, and a lot of people ask if you can do these kinds of changes with an outside contract like Sodexo or something. And I think it really depends on the situation. In some cases, the food service company is just not able to make these changes, but the contract will expire. And it's a great opportunity to kind of get a foot in the door and kind of write a new contract, maybe find a company that will be willing to do this. I had one experience as I've been working with PCRM and other hospitals where the hospital had the opportunity to hire a new food service company, and the new company, they went with Morrison, and they're very eager and on board to make changes and to promote healthy options. Morrison specifically is very client focused. So if you are the client at the hospital, and if you have enough people on board asking for the same things, the job of the food service provider is to make the client happy, and the hospital should be able to ask for more plant-based options, knowing that's best for the patient. And then another question that comes up is when patients are admitted for GI issues. And that does happen a lot, and we're not recommending plant-based diets across the board as soon as you get your foot in the door. In some cases, you have to go very slowly, and we recognize that hospitalization is not always the time to make major changes in your diet. But in some cases, with non-GI issues, it is a time to try new things and kind of think about longer term changes that you could make outside of the hospital. And that's where the plant-based options come in. And then there's a question that comes up about carbohydrate content because plant-based foods tend to be higher in carbohydrates. So it's really an opportunity to talk with patients because they often get put on a CCD diet, consistent carbohydrates. So they're really counting those carbs, making sure they're in the limit. And the main goal here is to prevent people from having too much sugar specifically, like ordering multiple desserts or several glasses of milk where it's just that simple sugar, or too much Jell-O at one time. But as a dietitian, we can talk to patients about complex carbohydrates. These are the healthy plant-based carbs that we want people eating. And if they are eating only these healthy carbs, their blood sugars should be well managed, but we can always monitor that and make sure it's going well. Sometimes the doctor will put a patient on a low carb diet, which I always tend to go and talk with the doctor, talk with the patient, make sure they understand simple versus complex carbs and try and liberate that a little bit. So it's at least a standard carbohydrate diet. And then there's tons of research on diabetes and plant-based diets showing that insulin function really improves. So over the long term, as you lower the fat and remove the animal products from the diet, the carbohydrate content is not as much of a concern. And then I wanted to move on to our patient satisfaction scores, which have just remained high as we've been making these changes in our hospital. We hear so many positive comments about our food. And when people have a choice, they do choose this hospital over other hospitals because they know that they can eat well, which makes such a big difference. And the food is part of that healing process, and the patients recognize that. So if you wanted to see the AMA guidelines implemented at your hospital, I have some tips to get started. The first step is to just connect with other people, other employees, healthcare providers, administration, anyone who has an interest in seeing these changes as well. If they don't yet understand the importance of providing plant-based options or eliminating processed meats, definitely ask if you can share some resources. It might take some time, but just being persistent and kind really pays off. And then you get to try new things, try some new recipes, some easy replacements, do a lot of taste testing and free samples. Once you pick the best options, then just add those to the menu. And the last part is just a really strong education campaign. Doing education early on before you even make the change is going to make a big difference to get everyone on board, from the patients to the staff to the providers, and making sure people don't feel surprised by this change. And we have some resources as well on our website, pcrm.org/healthyhospitalprogram, which you can find here. We have our power porridge here, but this is a whole book of recipes being used at our West Coast Adventist Health Hospital System. And then we also have a healthy food and healthcare toolkit with more specific steps to getting started with menu changes. We have some marketing assets, some table tents, handouts about processed meats, lots of resources to get you started if you want to visit our website. And feel free to contact me as well. You can email me at aherbie@pcrm.org. We do consultations with hospitals to help them make these changes as well. So thank you so much for your time today, and I will see you all later.
Thank you, everyone, for joining this webinar. It was a pleasure to have you all here today, and thank you to our wonderful speakers. We had a lot of questions come in about the Healthy Hospitals initiative that was presented by Alana. So I wanted to share where you can find more information about that. If you go to nychealthandhospitals.org, there's a press release from September 29th, 2022 that details how they rolled out this plant-based initiative into their hospitals. And then there's also a really great article about the rollout. It is on vegoutmag.com, and it's called "Plant-Based Meals Are Now the Default at New York City Hospitals." So those who registered for the webinar will send you a link to these articles to get more information as well. There were also some questions that came in from Anna's portions of the presentation, asking about some of the plant-based kind of meat substitutes that were used. And so I think, what they were finding is that the plant-based meat substitutes, specifically the sausages, were introduced really to take the meat-based sausages out of the cafeteria. Not to say that those would be the healthiest options, compared to something you could make from scratch. But since we do know that processed meats are a likely carcinogen, says the World Health Organization, that was a great first step for them to just take that step towards a more nutritious diet and get some of those higher risk foods out of the cafeteria. And those products, as she mentioned, were seeing good acceptability, really not just among people who identify as plant-based eaters, but people who are who enjoy meat as well. We also got some questions about implementing plant-based initiatives in your own hospital. So I would definitely encourage everyone to learn more about the resources that both of the presenters introduced, both Default Veg and PCRM. They have great toolkits on both of their websites. And I wanted to share what we offer at Oldways. We worked with Sharon Palmer, who introduced this session today, to come up with a plant forward plates toolkit. So basically, it's a collection of 40 recipes that are food service scaled up to 100 servings. And it includes therapeutic menu plans. So basically, like how you would need to adjust the recipe to meet different therapeutic diets, as well as HACCP instructions, nutritional analysis, and food ordering guides. And so it's, it's not a computer program, but it's actually a PDF collection of recipes. And I think this is great, especially for those of you working in states that have introduced legislation mandating plant-based meals in facilities. And these recipes were developed by Sharon. And so she's really great at using low-cost ingredients. This program is more like scratch cooking. It doesn't necessarily call for some of the more highly processed meat substitutes that you might see at some facilities. So if this is a path that you're interested in, please visit us at oldwayspt.org, and we'll also share information in the follow-up email as well. So thank you everyone for joining us. We hope you'll tune in to our next webinar. And you can find more information about Oldways webinars by visiting oldwayspt.org. And you can click on CPEU library in the top right-hand corner, or you can go to oldwayspt.org/CPEU. And yeah, check out everything we have. So thank you.